Hi, I'm Dr. Aaron Gorin of Gorin Plastic Surgery and Med Spa. Today's video blog is on breast lifts. Now, breast lifts is something that is very commonly performed for women who have sagging type of breasts after having babies and breastfeeding and that type of thing. They often come in not really understanding what's involved in a breast lift. Breast lift is typically much different than a straight breast augmentation. Now, breast augmentation is simply where we place an implant into the breast pocket to make the breast more larger and perkier. However, breast lifting allows the surgeon to elevate the breast into a position that might have been there before breastfeeding. The scars and the incisions are certainly different between the two procedures. And this is something that I spend a lot of time with in the consultation to try to get patients to understand what the end result will be. The end result typically is much improved from where they were to start with, except the incisions are longer than breast augmentation. Picture an anchor on a boat where the incision goes around the areola and then down the breast middle and then a little bit in the breast fold as well. Now, this is a little bit different than the breast augmentation incision, which is just an incision in the breast crease. But the benefit is a much nicer breast shape from where they were before. Now, many times I will be recommending an implant at the same time as the breast lift. This is so-called the Mastopexy augmentation, which is a breast lift plus the implant. I do this more often than not in order to maintain a nice overall perkiness to the breast, a better shape, and a little more fullness to the upper aspect of the breast. Now, some people ask about recovery time, which is a good question. Recovery time typically is about a week or maybe a little bit longer after surgery to get back to things like a desk job. As far as getting back to activities like running and weightlifting and going to the gym, I typically suggest about 2 weeks off from that until things have started to really heal, but we need to wait about 6 weeks before going back to the gym for upper body workouts. The procedure is done here in our office in our fully accredited surgery suite. It's under anesthesia, but one of the differences here between my office and others is that we really try to avoid the need for the breathing tube. And that's the tube that goes down the throat to help breathe for patients during surgery. Instead of that, we found a much gentler way of anesthesia, which is just the IV sedation. You're still completely asleep, fully relaxed, and unaware of what's going on, but I feel it's much safer and a much more gentle kind of recovery as you wake up. The length of surgery is about 2 hours or so, sometimes a little bit longer when we're doing the breast augmentation at the same time. Sometimes even a little bit longer when we're combining that with other procedures, which is also very common, such as liposuction or tummy tuck, which would be something called a mommy makeover. As far as other questions to ask as I have patients in consultation, one of the important ones is what happens if we need to revise something. It's quite rare that we need to do so, but when we do, we make a policy that patients don't have to pay anything for that revision in the first year. This is a bit different from other offices, and it's something that should be asked each time the patient comes in for a consultation. I look forward to meeting with you in my office. Feel free to contact me anytime through email at drgorin@gorinplasticsurgery.com and through my website at www.gorinplasticsurgery.com.